Question 1. Tell us a bit about yourself and your career. I'm a family medicine specialist and early career academic. I am now currently working as an assistant professor at Istanbul Medipol University in Istanbul, Turkey. And I have been an active member since the beginning of my medical journey at national and international organizations. And I am passionate about comprehensive, preventive, person-centered care. And I'm completing a PhD in public health, hopefully this year. And my thesis analyzes the national survey data to understand determinants of preventive health service use. And my family medicine training dissertation was testing an intervention to reduce unnecessary pediatric emergency department visits. And now I teach history taking, communication, OSCE skills, medicine humanities, and in School of Medicine. And I try to guide family medicine trainees, and I try to design to learning materials to translate evidence into everyday practice. And I am keen to integrate digital health and artificial intelligence in family medicine. Therefore, we established a special interest group in this innovative topic with my colleagues. And I have presented across WONCA networks, WONCA Europe, WONCA World, EGPRN, Europrev, Euract, and EYFDM. And I have published internationally. I'm trying to build collaborations to connect research, education, and policy. Question 2. Why did you apply for the WONCA Europe Scholarship? I applied for the WONCA Europe Scholarship to sustain high-impact academic growth and structured mentorship and international collaboration. And these areas are often limited by financial barriers. As I am the first recipient from Turkey, I aim to represent my country with pride, but also I would like to try widen access for younger colleagues. And I would like to translate preventive care research to practice across Europe. And I am hopeful that WONCA Europe Scholarship will support my development in both my professional and organizational capacities, and the remove of the key barriers to international collaboration and advanced training would be significantly beneficial for me to have a structured support and visibility to help me to turn promising projects into practical tools that are transferable across nations. Third question, have you been involved with WONCA or EYFDM before? Can you tell us about this? Well, my WONCA journey began at the very beginning of my training with EYFDM. Well, it was Vasco da Gama at that time. And the first event I attended was the 5th Forum of Vasco da Gama in Porto, Portugal in 2018. And I first became aware of the potential of the international collaborations, but also the valuable supporting community. And right after that, I started serving as the EYFDM, Vasco da Gama formerly, Turkey team, to have been the campaign and policy coordinator for the past 6 years till this year. And then I had the privilege to serve as an EYFDM executive board member and events officer for the past 3+ years till this September. And I have contributed to Good Governance Committee for 3 years, and I am a founding member and co-leader of Digital Health and Artificial Intelligence Special Interest Group of EYFDM. And I must say, this is the most popular special interest group at the moment. And while I was contributing to host organizing committees, helping to standardizing high quality events processes, and promoting inclusive participation, these roles sharpened my leadership, communication, collaboration, and implementation skills. And I have the opportunity to present at WONCA events and network events. And especially last year, I had the privilege to represent EYFDM at the opening ceremony of WONCA Europe Conference in Dublin. And last year, I was one of the finalists of EYFDM Junior Researcher Award. And this year, I won the WONCA Europe Scholarship at WONCA World Conference in Lisbon, Portugal. So it started at Portugal, and I achieved a prestigious scholarship in Portugal again. So, well, this journey has been an instrumental in shaping my professional development with series of defining experiences in my life. So I'm so grateful for that. And well, I'm an active member in EGPRN as well, and Europrair and Euract for a couple of years now. And I have presented my work. I once served as a host organizing committee for EGPRN, and I am well, hopeful and confident that I will be able to make valuable contributions to WONCA in the upcoming years as well. And I'm looking forward to welcoming you in Istanbul for WONCA Europe Conference in 2028. Fourth question: describe your plans for the award. Well, I am currently engaged in multiple international projects, all are at the same time, in parallel. I have a major project idea involving the design and implementation of an expanded European linked project related to my doctoral thesis in public health on preventive health services. This project will also analyze large data sets of European countries on the use of preventive health services, and it has the potential of numerous multinational, multidimensional collaboration and publications. And with the support of my mentor and on the mentors on this project, my highly esteemed public health professor for my doctoral thesis supervisor, associate professor Dr. Meryem Merve Örençelik, and my highly esteemed EGPRN mentorship program mentor, Professor Dr. Rados Asanova, I am eagerly anticipating the significant impact we can have through these various channels. And in addition to this, I am undertaking a further research project, and there is a protocol for this project was developed jointly with my intercontinental mentor, and he was assigned to me by the WONCA Working Party of Research Mentorship Program. And together with my highly esteemed family medicine professor from South Africa, Professor Dr. Klaus von Presenten, and many other colleagues from different regions and countries, we have a research study about research capacities of family medicine trainees and specialists. And we had already presented our study protocol at WONCA World Conference. And alongside with the major projects we have initiated with our esteemed professors, well, there is the valuable work we are carrying out with my young and brilliant colleagues from EYFDM continues to bear fruit as well, because we're pleased to announce that some of our research that we initiated at the EYFDM, Digital Health and Artificial Intelligence Special Interest Group leaders, now has been published or almost published in this month. And some of our projects are all near in completion. In the near future, hopefully we're going to present a selection of European and global digital health and artificial intelligence related projects, webinars and events to our young colleagues. And well, the fact that at least 3 of our applications are accepted at every WONCA event, and we couldn't fit into workshop rooms, can demonstrate the increase of the interest on these topics. So we're trying to contribute rational use of these innovative tools. And moreover, I have a project plan regarding the prevention gaps in primary care. Well, I would like to identify drivers of preventive service uptake and design practical primary care toolkits, because I already tested parent education, patient education through teaching materials, and now I would like to create open source toolkits for practices and teaching modules for trainings to expand the impact. And I will use these opportunities to attend WONCA conference and network meetings to strengthen my methodologies, harmonize data, and accelerate disseminations. Therefore, I would like to prioritize this, and throughout this process, I will prioritize a sustainable research culture in primary care. Fifth question: how do you think the scholarship will help your career? Well, this scholarship will provide stability to attend key events and meetings, and it can provide continuity because, travel and registration support will sustain the international research, targeted training for me to deepen the methods that I'll achieve, and mentorship, structured mentorship to accelerate my publications and implementations. And this mentorship and visibility hopefully amplify my contributions to WONCA and within WONCA Europe, and hopefully it will help me strengthen leadership roles and leadership skills in WONCA network organizations for me, and it can help me mature into a clinician and scientist who can mentor others wisely, and it could help me to advance both patient outcomes but also the research culture of primary care. Question 6: can you tell us about a family medicine doctor who inspires you and why? Well, I have had the privilege of working with numerous mentors and supervisors, and I'm certain that I will continue to benefit from their guidance throughout my professional career. And I consider myself very fortunate to have access to national and international mentors that I can consult for advice and guidance on my career path. And I met these mentors at many WONCA events I have since I began my career, and I have been honored to receive guidance from esteemed professionals like Professor Dr. Amanda Howe. Well, after presenting my first presentation in English as a fresh trainee at the Vasco da Gama Forum in Porto, I met a former president of WONCA because she asked a genuine question about my research, and ever since she has continued to broaden my horizons and still does to this day. And I would like to emphasize how fortunate I feel to have received Professor Dr. Rodos Asanova's support and guidance since the day she was assigned to me as my mentor through the EGPR mentorship program. And she constantly demonstrates autonomy in her support for my professional development and my professional decisions, offering guidance and counsel that is both insightful and beneficial to my career development. And she demonstrated consistent success in fulfilling various roles, including of being a mother, a wife, a medical doctor, a family doctor, in addition to holding a senior position at medical faculty. She is serving as a member of the WONCA Europe Executive Board and contributing member and a representative of EGPRN, the prestigious research network. And not only that, but also she is playing an indispensable role in numerous international collaborations in EGPRN and WONCA. And her ability to juggle multiple roles like WONCA World Conference scientific committee co-chair with EGPRN meeting, host organizing committee chair at the same time, but while maintaining her warm, kind, and natural leadership style. Her success as a respected researcher and her unwavering commitment to her endeavors, but all while she's never compromising from her humanistic values. And this all serves to solidify the profound admiration that I have for her. My mentor, Professor Asanova's inspirational approach combines a rigorous practice-relevant research and a commitment to genuine mentorship on an international scale. And her guidance turns evidence into simple recommendations for busy minds like mine. And while she's doing this, she's modeling humility, perseverance, and sustained support for young scholars. And this is exactly the kind of impact I aspire to make.